Welcome back to Newsday. Thank you for staying with us. To the UK now, where a 48-hour strike by senior hospital doctors in England is underway, with NHS bosses warning of severe disruption. Thousands of consultants walked out from 7 a.m. in their dispute over pay. It is the first time the consultants have taken part in strike action since 2012. Only emergency care and a small amount of routine work, so-called Christmas day cover, will be provided. It comes just 2 days after a 5-day walkout by junior doctors came to an end on Tuesday. Well, Arise correspondent Lape Olarinoye has been monitoring developments and joins us now from London for more. Hello, Lape. It's good to have you here on Newsday. Can you tell us more about why these senior doctors are going on strike?
Well, most doctors in the UK, Shaita, are part of a union which represents doctors. They're known as the British Medical Association. And of course, a part of those doctors are divided into junior doctors and, of course, consultants. Now, consultants in the UK today, 50% of them are said to be going on strike, all about pay, which has been the same reasons that thousands of people across various sectors, especially industrial sectors in the UK, have gone on strike. It's all about pay in the midst of this worsening cost of living crisis. Now, if we look at the consultants, they are integral to the running of not just the medical field and the very much treasured NHS, but also they're responsible for supervising junior doctors. And so for that reason, they are saying that they're overworked, they're underpaid, and actually that they have taken more of a hit on their pay with regards to inflation more than anybody else. Data also backs that up. Consultants, senior doctors, of course, have taken between 17 to 27% of a reduction in their pay in line with inflation. So they're calling on the British government to match their pay in line with the current inflation. Something which, they, like you've rightly said there in your introduction, they haven't done for the last 11 years. So at this point in time, it's desperate measures.
Desperate measures indeed. Now, Lape, what has the government's response been to this call?
Well, the Health Secretary here, Mr. Steve Barclay, has stated quite profusely that they won't be reviewing any more pay increases. Just a couple of weeks ago, the Health Secretary, as well as the rest of his counterparts in the government, agreed to increase public sector workers' pay by 6%. That includes teachers, doctors, ambulance workers, and the likes. Now, senior consultants, or consultants, if you like, senior doctors, should I say, are very much included in that pay review. And actually, that brings their current salary up for the basic consultant to about £93,000 a year, including, of course, that 6% pay increase that the government approved. Just to put that into context, that's just under 100 million naira a year for the average consultant in the UK. And so for that reason, even today, ahead of this strike, the UK government, that is, has come out again to state quite clearly that they won't be reviewing that. Now, it's worth noting here that that figure does sound quite, a lot to many people, but that is over a 19-year experience. For many senior consultants, should I say, stop calling them senior consultants, senior doctors, they have to accumulate many years of experience, a high level of responsibility to be able to be responsible for people's lives and so on. And that is why they can accumulate that kind of pay. But they are still stating that they have been the worst hit since the cost of living crisis and, the continuous high inflation has come about. So that's why they're calling for an increase in that. Just worth adding on here as well that in addition to that £93,000 that they get as basic pay as consultants, they also have another further increase of 30% for additional hours, as well as what they describe here as a clinical excellence award, which is like a bonus for doctors. So a lot of consultants in this country are already on very high salaries compared to all of the other thousands of people across different sectors that are also going on strike about pay. The pay gap, if you compare it, is completely wide.
I mean, the strike means that the NHS would have to operate on a much reduced level of service. So I'm curious to know, is there public support for this strike?
Well, a very good question that you asked there, Shaitan. I would say, based off of what I've read and the people I've spoken to ahead of this strike, there isn't that much public support for senior doctors, consultants, predominantly because people are aware of how much they earn and how how different their lives could be to the average person. There was a lot more sympathy for junior doctors who went on strike just last week and were given a pay review by the UK government of 6%. In contrast, in complete disparity to them, they are earning, the average doctor earns about £14 an hour. That's the same as somebody that works in a coffee shop. And so the sympathy and the encouragement of strikes for junior doctors has garnered a lot more public support than I would say for senior doctors.
Well, Lape, since you're making it clear that there's not much support here, public support, and also you've made it quite clear that the government's response has not been very positive in this case, do you anticipate, I know you're not an immigration expert, but do you foresee a scenario where there might be new pathways open to invite more health experts from around the world to fill in the gap that might be created based on this?
Again, another good question. I mean, I think I can be corrected on this. Please don't quote me on this, but I sense that there will be an influx of more junior doctors, because currently the junior doctors in this country are being enticed, just like we're seeing from other parts of the world, like Asia and Africa. They are also being enticed to go to other countries like America and Australia, where their workload is far less and they get paid a lot more, with accompanied by beautiful weather and waking up to scenes of a beach. The same thing is happening for junior doctors that want to migrate from places like Africa and Asia. But actually, if we look specifically at consultants and senior doctors, the room for that kind of recruitment is far more slim. Like I said, it takes 19 years worth of experience in the UK to rise to that level. And actually, it's a lot more narrow space for people to just migrate from abroad and suddenly become consultants. There's a lot of medical exams that need to be taken, a lot of experience that needs to be happening on ground. So in a nutshell, in answer to your question, not so much for consultants, I don't think, but definitely there's growing space and there's this growing sense of recruitment for more medical staff, not just from, doctors, but also from nurses, from healthcare workers, from ambulance workers, paramedics, and so on, to come from other parts of the world. And we're seeing that continue to rise with the number of recruitment, the level of recruitment, and the sheer number of people coming in to work for the ailing NHS.
Thank you so much, Rise News correspondent live from London, Lape Olarinoye. We appreciate your time here.